Now, there have been some inaccuracies with statistics on deaths from injuries. This is according to the South African Medical Research Council. Now, it says this is due to the official death notification form not allowing reporting on the manner of death. The council wants government to update the country's official death notification form. And for more on this, we are joined by Dr. Pamela Groenewald, who is from the Medical Research Council. A very good morning to you, Dr. Groenewald. Thank you so much for your time. Now, you say that there is a gap in the number of people who are actually reported to have died from injuries based on what the government is reporting. Why is this so, and how huge is the gap that you have noticed?
Good morning, and good morning to your listeners, and thanks very much for inviting me here. So yes, with injury deaths, the official statistics report that only about 2/3 of the deaths are due to unintentional causes, with 10% due to homicide and 11% due to road traffic injuries. However, when we look at the mortuary data, it shows that 36% of the injury deaths are due to homicide and 33% due to road traffic injuries. So you can see there's a wide disparity between these results. And then if we look at firearm-related deaths specifically, the official statistics report that 98% of these are unintentional or accidental deaths. However, the mortuary statistics show that at least 90% of these are due to homicide and about 7% to suicide. You can see from that these statistics are extremely inaccurate.
So what's clear from what you're saying, Dr. Groenewald, is that the source of where the information comes from is what makes all the difference. You, as the SA Medical Research Council, are basing your statistics and your counting from what comes out of what's seen in the actual mortuaries, while government is looking and basing their statistics on what is reported on the death certificate. Is that what you're saying?
Yes, yes.
So how then is one going to ensure... Let me allow you to continue. Please continue, Doc.
I was just going to explain to you why what the problem is with the form. So just to explain to listeners who may not know the term, manner of death distinguishes between unintentional homicide, suicide, and then natural disease. And this information is required to code the cause of injury accurately. And the coding convention, where the intent is not specified, is to code the injury to unintentional. Now, the reporting of the manner of death is not required on the South African death notification form. And this is contrary to the WHO International Standard Death Certificate. And this is really where the problem lies. We don't get the manner of death on the death notification form, and thus we cannot code the official cause of death injury data correctly.
Why is it important for government and, I guess, the general public to have accurate figures and numbers in this regard?
Well, firstly, homicide is grossly underreported, which means that the problem does not receive the attention or the visibility to ensure appropriate action. And if you don't have accurate information, your interventions to reduce violence and injury cannot be planned and targeted appropriately. And then, you cannot monitor the impact of any interventions that you do implement. And then also the Sustainable Development Goals have a number of indicators which require accurate injury cause data. Two of the important ones are, number one is to halve the road traffic injuries by 2030, and then the other one is to just reduce intentional homicide everywhere.
The numbers and the deficit and the difference between the numbers that the government has and the numbers that you have is way over 300%. How is this going to be rectified? I mean, you've just highlighted why it's actually important to have these accurate figures, but how is this going to be rectified? What are the recommendations that the SA Medical Research Council is putting forward?
Well, the most obvious answer is to amend the death notification form in line with the international recommendations. And we've been calling for that since 2012. It requires that the stakeholders in charge of official statistics, which are the Department of Health, the Department of Home Affairs, and Statistics South Africa, sit down and, agree that this is important and amend the form. It's as simple as that.
You did mention that it's part of the World Health Organization regulations. Could they not liaise with the WHO for guidelines on what the standard practice ought to be?
Well, the guidelines are there. The guidelines have been published in the WHO International Classification of Diseases. A standard template of the internationally recommended certificate is there. Guidelines are there.
Guidelines are there. That's Dr. Pamela Groenewald from the South African Medical Research Council. Thank you so much for bringing this very important issue up, and also the call from the SA Medical Council for health, Home Affairs, statistics, to ensure that there is accuracy in the reporting of the cause of death. So if you know what the cause of death is, then you are better able to implement and put together interventions for the entire country. Thank you very much to Dr. Groenewald.